my name is Ikbal and I'm an adult and child clinical psychologist. Today we will be sharing with you tips on how to deal with OCD. OCD stands for Obsessive-Compulsive Disorder, and OCD is a type of anxiety disorder and it causes people to experience obsessions and compulsions. Obsessions are unwanted thoughts and compulsions are behaviors. So thoughts can be about contamination, unwanted sexual thoughts, fear of harming self or others, religious preoccupations, and many others. And because these thoughts are so unpleasant, the person would want to neutralize them. And this is where compulsions come in. So compulsions are repetitive behaviors and acts done either in the open or mentally. And usually, rituals are done in a specific way, a certain number of times, or until it feels just right. For example, a person might need to slam a car door 3 times in order to make sure it's closed properly. If you know someone suffering from OCD, you have to know that telling them not to feel anxious doesn't make them less worried, and oftentimes it makes them feel worse. So if you've fallen for the trap of saying, just stop, or why do you keep doing that? Know that the person is already struggling and they feel helpless and out of control. So usually the treatment of choice for OCD is CBT. CBT is cognitive and behavioral therapy, which means the person will learn how to identify their thoughts and build a better understanding of how their thoughts affect their emotions and how their emotions reinforce the checking and seeking reassurance behavior. Now, one key intervention for OCD involves identifying the thoughts and urges as symptomatic of the disorder, which means when you experience obsessive thoughts and behaviors, do acknowledge that this is OCD. While this might seem pretty obvious at first, people, when they miss on realizing that this is their OCD tricking them, they tend to experience the triggers as real threats. So externalizing OCD as something separate from yourself can be very helpful. Also, a lot of times you will feel like you would rather want to isolate. Staying connected to the people you love and doing activities you enjoy will help in decentralizing OCD, which means your OCD will no longer be the center of your attention and more time and energy are invested in things that make you feel better. If you're helping someone suffering from OCD, you will notice that the person would often ask for reassurance or would ask you to assist them with the OCD rituals. As this might reinforce the OCD cycle, it is important to set limits on how much reassurance and assistance is given. Lastly, oftentimes the therapy is combined with medication for optimal results. So if you're struggling to cope with OCD, do not hesitate to reach out to a professional, as you don't have to suffer in silence. Lastly, oftentimes therapy is combined with medication for optimal results. So if you're struggling to cope with OCD, do not hesitate to reach out to a professional, as you don't have to suffer in silence.